Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Now, humans have been searching for the fountain of youth for centuries, both literally and figuratively. And today we're going to be diving into the secrets of living not just longer, but healthier. And from the latest breakthroughs in anti-aging science to establishing everyday habits that we can all do that can really make a difference. And we have the dream team with us here, Dr. Madeline Camejo, Chief Pharmacy Officer for Baptist Health, and Dr. Emilie Collongette, a Clinical Ambulatory Specialist. They are standing by to help separate fact from fiction and to answer your questions as well on this episode of Ask the Doc. I'm Kathy Buccio, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. So let's kick things off with a question from one of our viewers, because I personally want to know how to live a little longer, right? So today's first question comes to us from Reggie, who just reached out to us through our website, allhealthtv.com. Reggie's question is, hey doctors, my wife Talia and I are South Floridians, and even though we don't live in Soviet Georgia eating yogurt, we want to live to be 100. So would you please tell us what the top daily habits are that can improve our chances? Doctors Camejo and Collongette, I wouldn't mind getting in on this action as well. So what are some of the secrets to longevity?
So Reggie, a great pop culture reference as well as a great questions, but the secret to longevity is a couple of things. Regular physical activity, engaging in at least 150 minutes in moderate intensity aerobic activity or 75 minutes of active activity, along with muscle strengthening, 2 days of that. This really helps improve cardiovascular health and maintains muscle mass, improves mood, and really reduces the risk of chronic illness. The other thing is having a balanced nutrition. Consume a diverse diet of rich fruits, whole grains, lean proteins, healthy fats. These are the essential nutrients to help support that immune function and reduce the risk of chronic disease. Now, the other thing is sleep. Is a lot of sleep. Aim for at least 7 to 9 hours of quality sleep each night and maintain a consistent sleep schedule. And the other thing is stress management. Practice stress reducing techniques such as mindfulness, meditation, deep breathing exercises, or even some yoga daily. This really helps maintain those cortisol levels, which help improve emotional well-being, as well as reduce the risk of disc-related illnesses. And the last thing of anything is really staying socially connected. Being out there, having maintained meaningful relationships with family, friends, and community, this will help improve and support emotional support, reduce those feelings of loneliness, and really contribute to overall happiness and mental health. These practices really help reduce the risk of chronic disease and really boost mental health and contribute to the overall well-being. Remember, consistency is crucial to reaping those long-term benefits.
Thank you, Dr. Camejo, and absolutely right. Those meaningful relationships, that connection is such a component and to longevity and really having a healthy life. But heads up, we've got a YouTube question. Sent special delivery for y'all from Adrian. And Adrian asks, my wife Cordelia and I both have very stressful jobs, pretty stressful jobs. We also want to jump on the longevity train. So do you mind sharing any effective stress management techniques for us? I love that longevity train. I'm loving that. So Dr. Camejo, are you going to take this one or pass it off to your protege, Dr. Collongette?
I'm going to hi, Adrian. Thanks for reaching us out with your question. But Dr. Collongette, why don't you take this one?
Yeah, so chronic stress can increase the risk of heart disease, weaken the immune system, and accelerate aging. So effective stress management can include a multitude of things, right? So mindful meditation, practicing mindfulness and meditation can help to reduce anxiety. And you can even use apps like Headspace or Calm to help guide you through the process. On top of that, regular physical activity. So physical activity releases endorphins, which are like natural mood lifters. So activities like walking, jogging, yoga, or even dancing can be effective. Taking into account time management. So trying your best in your busy schedule to organize your time and setting realistic goals to help you prevent from feeling overwhelmed, prioritizing tasks, breaking them down into smaller steps and smaller tasks can definitely help things feel more manageable and have less of that stress impact on your day-to-day. Healthy eating, right? So trying your best to follow a balanced diet can impact how you feel, making sure that you're incorporating foods rich in omega-3, antioxidants, and vitamins can help your body combat and manage that stress. And of course, if needed, professional help, right? Stress can become very overwhelming if it's persistent. Seeking help from a mental health professional can provide you with additional strategies and support. So those are just a few tips to consider.
These are fantastic, Dr. Collongette. I know you mentioned Headspace and Calm. I really love one that's called Insight Timer, and they have everything from like 2 minutes to 1 hour of mindful meditations or affirmations.
Yeah, so many apps, you know, even with like the Peloton subscriptions as well. So there's a lot of resources and apps that have those mindfulness and meditations built into them that you wouldn't even think of sometimes.
I love that. Okay, we got another allhealthtv.com question. It's from Bradley, who asked, "Hi, Dr. Camejo. I just hit the half-century mark and I still jog and I play tennis to stay in shape. I feel pretty good, knock on wood, but I know my body's aging. So I'd like to know what are the best age-appropriate supplements to support wellness and longevity?" Great question. I'm nowhere near the half-century mark, but I guess I will be one day, so I would like to know as well.
Well, Kathy, I'm at that halfway mark. And this is a great question, Bradley, and thanks for reaching out. But when you consider evidence-based supplements for longevity, it really is crucial to focus on those that have substantial research supporting their benefits for health and lifespan. So here are my well-researched supplements and my top 5. Omega-3 fatty acids. You know, evidence show that numerous studies show that link omega-3 fatty acids from fish oils to reduce cardiovascular disease, improve cognitive and function, and lower inflammation. Vitamin D is a great support of bone health, immune function, and has the associated with reduced risk of chronic disease and improved longevity. So many people have suboptimal levels, particularly of those who have limited sun exposure. So vitamin D supplements are really important for those folks. You know, probiotics. Evidence show that probiotics support gut health, which is increasingly linked to overall health and longevity. And evidence suggests that they do improve digestive health, enhance immune function, and may even impact mood. Now, magnesium is another one. Magnesium supports numerous psychological functions, including muscle and nerve function, and may help with sleep and relaxation. So adequate magnesium levels are associated with lower risks of chronic disease. And last but not least, CoQ enzyme 10. So CoQ10, evidence supports cellular energy production, has a lot of antioxidant properties, and they suggest that it can improve cardiovascular health, reduce oxidative stress, and particularly in older adults.
Dr. Camejo, I actually have a follow-up to some of these. This is the second time I've heard about magnesium, especially if you have a difficult time sleeping, even for like lowering stress and anxiety. So do you take this in a pill format? Or
sure, they come in supplements, and and also helps with calcium. When you take magnesium, it really helps you absorb calcium. So it's really important for that, and it's good for bone health as well.
And for as far as omega-3, I know that's a big one, and I'm not someone that eats a lot of fish. So could I get an omega-3 supplement as well?
Yes, omega-3 supplements usually come in kind of like, they look like fish oil capsules, and they're usually, you can get those at any of the stores, especially in the pharmacy.
Oh, thank you. See, we're all learning here on Ask the Doc. All right, this next question comes to us from Xiomara with Instagram, finally making an appearance here. Hello, Dr. Collongette. I've never been a great sleeper. Now that I've reached a certain age, how important is sleep in regards to wellness and longevity? And what can I do to improve the quality of my sleep? Doc, it seems that everyone has an opinion about what constitutes good sleep. So is there a number of hours or something else that we can define sleep by?
Yeah, so sleep is definitely important, right? An important factor. Poor sleep can lead to increased risk of chronic conditions like obesity, diabetes, and cardiovascular disease. So there are a few things that we can do to improve our sleep quality. We want to establish a regular sleep schedule. Create a relaxing bedtime routine. Avoid caffeine and electronics before bed, trying to avoid anything with a blue light, your phone, TV, and ensure a comfortable sleep environment would be like the key takeaways.
Dr. Collongette, what's your take on sleep supplements?
Sleep supplements can enhance your sleep routine, but I think the biggest thing is a concept that we call sleep hygiene, right? So really setting up that clockwork, that system for your body, right? Making sure that you're dimming the lights, you're not getting into bed and spending a long time in bed. Let your mind kind of process, okay, this is a place to relax, to sleep. If you're taking melatonin, actually the blue light from our phones and from the TV deactivates that natural melatonin in your body, right? So it is important to follow these supplements with appropriate sleep hygiene and appropriate routine to really kind of bring everything together and really help your body get into that relaxation and that sleep state.
Thank you for that. Now we've got another YouTube question, and this time it's from Doyle. And Doyle asks, Dr. C, I've noticed that as I've gotten older, I'm just not drinking as much water as I used to. Having said that, how important is hydration for health and longevity as one ages? All right, docs, how much H2O should our friend Doyle, and probably all of us, should be drinking?
So Doyle, thanks for writing in and watching the show, but staying well hydrated really supports bodily functions, such as regulating body temperature, maintaining electrolyte balance, and aiding in digestion. Chronic dehydration can also lead to kidney problems like, kidney stones if you're not drinking enough water. So make sure that, you drink and you hydrate, because cognitive decline is also risk of dehydration, increased risk of certain diseases. So drinking enough water daily, roughly 8 glasses of the most, is what is most essential for overall wellness.
Oh boy, I gotta up that. I have to up my hydration. I don't think I'm at 8 glasses per day. Okay, so I have work to do. All right, we have a really interesting Facebook question here. It's from Daphne, and she wants to know, hello doctors, are there specific diets or nutritional plans that are scientifically proven to enhance longevity? This is such a great question. It's almost like Daphne's asking if food can be considered medicine, and we know that it is.
And that is true, Kathy. I think you're absolutely right. And Daphne, thanks for reaching out. But I would say the Mediterranean diet is the most renowned for its numerous health benefits. And based on traditional eating patterns of the countries bordering around the Mediterranean Sea, where you see a lot of those blue zones, this diet really emphasizes whole, minimal processed foods and healthy fats. And here are some of the key health benefits that are associated with the Mediterranean diet. Now, numerous studies have shown that the Mediterranean diet lowers the risk of heart attack, stroke, other cardiovascular events, and there's also mountain evidence that it shows that it can lower the risk of developing type 2 diabetes and improving glycemic control in those who have diabetes. Now, the diet's fiber-rich food promote healthy gut and improve digestive function. And lastly, a lot of the studies suggest that people who follow the Mediterranean diet have a lower risk of death from various causes, including cardiovascular disease. And so I'm going to give you some key components of the Mediterranean diet. So healthy fats, primarily from olive oil, nuts and seeds, fruits and vegetables that are high consumption of a variety of fresh produce, whole grains, foods like whole white bread or brown rice or quinoa, legumes, beans, lentils, chickpeas, fish, and seafood. The Mediterraneans eat a lot of fish and seafood. So regular consumption of fish and seafood is important, like salmon, sardines, and mackerel. Lean proteins, any moderate amounts of protein and dietary, as well as herbs and spices. Use that instead of always using so much salt. And you know what? Red wine, consume in moderation, is really desired.
Well, I followed number 8, so I feel like I'm going to last a long time. But you mentioned blue zones, which is fantastic, Dr. Camejo. It feels like the blue zones really hone in on this Mediterranean diet lifestyle. Correct? It's a lifestyle. Correct. Let's be honest.
They do, and if you watch what they eat, it's not just about the eating, but they have a daily routine. Most of these people get up in the morning, they walk to the market, they get their produce fresh for the day. They don't keep a lot of processed foods in their house. They walk, they're constantly active. They have little things that they do around the house. They're never in a stationary way. And the thing is how they eat. They eat a lot of olive oil. They cook with olive oil, so they don't eat, they don't cook with that what I call processed oil that we use, or any of those oils that are bad for you. But I think this is why you see most of these areas are really all pretty much, those blue zones are all around the Mediterranean Sea.
So what you're saying is we need to move to Italy.
Yes, I would. Especially for the food.
Yes, right? All right. So we have another question from Insta, Dr. Camejo this time. It's from Maurice, who asks, "Hi, Doc. I've been reading a lot about intermittent fasting lately, and I can't help but be curious if and how does this impact health and longevity, and is it safe for everyone?" Okay, Maurice piqued my interest with this terrific question. What do you think, docs?
Great question, Maurice, and I'll go ahead and take this one. So thank you for writing in. Intermittent fasting has shown to improve metabolic health and even potentially extend lifespan by promoting cellular repair response. However, it's not always suitable for everybody. So we do recommend making sure that you're consulting with your healthcare provider before starting intermittent fasting, just because with certain medical conditions and eating disorders, it's not always recommended. So make sure you reach out to your medical professional beforehand.
Dr. Collongette, can you expand just a little bit of what exactly is intermittent fasting? What is it considered?
So intermittent fasting is when we essentially set up a time frame and a schedule for the times that we eat and the times that we don't eat. There are a variety of intermittent fasting schedules. For example, there are intermittent fasting where it's 12 hours eating, 12 hours not eating, or sometimes extended intermittent fasting may look at 8 hours, which you do eat, and 16 hours where you're fasting. So for example, you set a time of, let's say, you eat between the hours of 12 p.m. and 8 p.m. And then from 8 p.m. to 12 p.m. the next day, you're in a fasting state where primarily you're just having water and not consuming food itself. But again, this is all dependent on your medical history. So it is important to make sure that you're consulting that with your healthcare provider.
But what are you eating between the hours of 12 and 8, let's say? Because this isn't a window just to basically gorge, correct?
No, the idea is you're still having, sometimes some people will follow smaller, more frequent meals. So maybe 4 to 6 smaller meals during those windows. So, every 2 hours having some type of small meal, which is focused, with incorporating protein, adequate fruit and veggie portions, as well as some carbohydrate intake. Sometimes if your schedule doesn't allow, making sure having within that window maybe 2 or 3 meals, but then making sure that we're incorporating, again, a variety of our food groups, making sure we're having adequate protein intake is going to be important. Those veggies and fruits for our fiber, natural sugars, and as well as some carbohydrate intake for adequate energy throughout the day.
Thank you for that. All right, this next question is from Cecily, who reached out to us on allhealthtv.com. You should really check out the website when you get a chance. There is chock full of great information. I'm sure everything you're looking for is going to be on there. But let's get back to Cecily's question. She wants to know, Drs. Camejo and Collongette, my husband Armand is an exercise freak. Yes, I said freak. He really likes to push himself to the extreme. My question is this: can light physical activities like walking and or yoga contribute to longevity, or is high intensity exercise necessary? Okay, first of all, there might be some drama going on in the home gym here, and I'm okay with a little drama, but yes, this is a great question.
So Kathy, a little occasional drama can be healthy too. By the way, but light physical activities like walking and yoga can contribute significantly to longevity, especially when performed regularly. That's the key. These activities improve cardiovascular health, flexibility, even mental well-being. And while high intensity exercise has its benefits, consistent, moderate activities can be used just as effective for promoting long-term health and reducing risk of chronic disease as well.
Thank you. Okay, we got one question from Lenny. This time it's coming to us via Facebook. Doctors, how do over-the-counter supplements compare to prescription medications in terms of promoting wellness and longevity? I'm going to let Dr. Collongette take this one.
Yeah, so I think when we're looking at the two, right, we want to consider common interactions and blood thinners like warfarin with certain foods, right? So we want to avoid leafy greens, foods that are high in vitamin K, also statins with grapefruits, and sometimes supplements, just like St. John's wort, which is an antidepressant. They have a lot of drug-drug interactions with foods, right? And sometimes, especially with our over-the-counter products, we start taking them and we may not know how they interact with our foods or with our medications. So again, it's always good to be mindful, to talk to your healthcare professional, or even access your pharmacist. Your pharmacist is the most accessible healthcare provider. So making sure you're consulting with a medical professional to see how certain medications and over-the-counter supplements interact. It's important to be mindful, right? Another example is fish oils. If you're taking medications for arrhythmia or a blood thinner, because of the high dose of this medication, it can interact with them. So I think the biggest takeaway, right, is that with the over-the-counters, we don't always know the interactions off the top of our head. We just pick it off the shelf and start taking it. So always consulting your healthcare professional before starting any over-the-counter or prescribed medication.
Thank you so much. Now, this one is for Dr. Camejo, and it comes to us from Audrey. She wants to know, how can I make healthier food choices when I have a busy lifestyle? I feel like I'm Audrey. So yes, this is a great question, Dr. Camejo.
No, it is. And, there's one thing I always think about, one of my daughters is so busy. Poor thing. She's a lawyer. So she really is always working hard. But one of the things that she does great, and it really is what makes a difference, is she plans meals in advance, focusing on whole foods, preparing simple, nutritious meals so that helps keep you on track, and helping keep those healthy snacks on hand, like, keep nuts, fruits, yogurt, avoid any processed high sugar or unhealthy fats. Also, making small gradual changes rather than overhauling your diet all at once can make healthy eating even more sustainable. I think that's the issue with a lot of folks. They're anxious about, oh, I want to get healthier, and they want to do everything, do a complete overhaul of diet. I always say the most important thing is really get in, do it slowly, change your eating habits. And if you meal prep ahead of time, 2 or 3 days, it really takes the stress off. You can get home, put your meal in the microwave or oven, and you're done. So I think preparing is really important. I always see her every weekend. She prepares her meals for the week, and she does an amazing job of staying healthy and in a very, very busy lifestyle.
Meal planning is a fantastic idea, Dr. Camejo. And I have one more question for you, actually. It's from Alicia from Instagram. Dr. Camejo, what are some superfoods that contribute to long-term wellness, and why are they beneficial?
So superfoods like blueberries, kale, salmon, nuts, green tea are packed with nutrients that are full of antioxidants and really healthy fats that can help reduce inflammation, support heart health, and even boost immunity. Now, these foods really contribute to overall health by providing essential vitamins and minerals that really support body functions. The berries are really one of the best. Strawberries, blueberries, any raspberries, those berries have a lot of antioxidants. So those are things that I would really look at doing for long-term wellness.
Absolutely. Well, thank you for that. Now, Dr. Camejo, Dr. Collongette, I want to get your feedback. We've had so many great questions today, so much great information, but what would be a good recap or what we want to take away from today's Ask the Doc?
I think like Dr. Camejo mentioned in her last answer, it's just overall making those small changes to kind of incorporate, all the elements, right? So making sure that we're trying to eat healthy, right? Trying to meal prep, trying to think of your meals ahead of time, maybe trying to change one of your meals and focusing on maybe just dinner time and making that small change, right? Because small changes add up over time. Trying to incorporate more movement, more exercises. A lot of the smartwatches do a great job of telling you, hey, you've been sitting down for an hour now. Getting up, getting those steps in, getting the stretches in, even when you're at your desk, because we are so sedentary, right? Making sure that we're sleeping enough, making sure that we're organizing our time and trying to set up our schedules so we can target that 7 to 9 hours of sleep. And again, I think the biggest component is that this takes time, right? So targeting one change at a time and slowly incorporating other changes once you are able to commit to that one change.
Thank you so much. Dr. Camejo and Dr. Collongette, what a pleasure having you on Ask the Doc again. Another week, another a great conversation. But that's all the time that we have for today. And I want to thank you all for joining us. I'm Kathy Buccio, and I'll see you next time on Ask the Doc.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.